brings us to your weekly capsule of health information. We like to call it Your Healthy Dose, presented by Hannibal Regional Hospital and Hannibal Regional Medical Group. And this week we're talking about lung cancer and getting screened for lung cancer. And joining us here in the studios is Dr. Humam Farah with the Hannibal Clinic, our guest here in the studio. Good morning, Doctor.
Good morning.
Thank you very much for joining us. So, screenings for lung cancer. Who should be screened for lung cancer?
Well, it's very exciting that now we have data that showed that screening actually does benefit and reduce mortality. For a long time, multiple studies were done, and none of them were positive or show any effect of screening and reduction in mortality. Until recently, the data showed that patients between the age of 55 and 74 who had a long history of smoking and who are still smoking or quit in the past 15 years could benefit from a program of lung screening. So if you're between the age of 55 and 74 and you have a long history of smoking, 30 years or more, and you currently smoke, or if you did quit smoking in the last 15 years, you are a candidate for this screening program.
So this is different than, say, for example, just getting an X-ray, which really doesn't reveal much.
Correct. So in the past, multiple studies done by looking at just a chest X-ray, and the sensitivity of the X-ray in detecting cancer actually is very low. So multiple studies done that showed no effect of just doing a plain X-ray. Other trials look at collecting sputum and looking for cancer cells in the sputum of smokers, and that also failed. The reason is the lung cancer, if you don't catch it very early, it carries a very high mortality. It's number one cause of death in both men and women right now in the United States. It kills more people than prostate, colon, and breast cancer combined. That's why you need to find it early, and that's why you need a very sensitive technique, and that's why the low-dose CT scan did show that benefit.
Doctor, is lung cancer primarily because of smoking?
The main reason for lung cancer, 90+% of cases, are smoke-related. There's very few cases related to genetics. There's some occupational hazards, like in coal mining or people who mine silica, exposure to radon, if you have radon in the basement of your home. But those are the minor cases. More than 90% of the cases are smoke-related.
Or maybe those that may have been exposed to asbestos at an early age?
Asbestos, the evidence, there is some evidence linking asbestos to lung cancer. Asbestos mainly cause another kind of cancer called a mesothelioma, which is a cancer of the lining of the lungs. If you are a smoker and exposed to asbestos, there is some data showing there's increased risk of lung cancer per se. But mainly asbestos related to a mesothelioma, which is another kind of cancer, as fatal as lung cancer, in the lining of the lung.
So, Doctor, you mentioned if you're a current smoker or if you have been in the last 15 years. Now, does that mean that if you quit smoking, it was a Great American Smokeout was this week, if you quit smoking, are you beyond the effects of smoking 15 years later?
Actually, the most recent data showed that around 15 to 20 years, your risk of complication from smoking goes almost down to a non-smoker level. Okay. But that requires a long, long time, long years. If you've been a smoker, especially if you have a smoke 30-pack year, and what I mean by that is a combined years and packs. So 30-pack years mean like 1 pack a day for 30 years, or like 2 packs a day for 15 years. If you're in that range of smoking, heavy smoker basically, then up to 15 years you still carry a risk of lung cancer. After 15, 20 years, your risk does go down, but actually never go down to 0, 100%. So that's why we encourage people not to start this bad habit, because once you have a long history of smoking, you're always going to be at risk, although it does decrease with time.
Okay, once you quit, you do start to heal.
Yes, you do. And people always ask me, I smoked for 40 years, do I benefit? And multiple studies have shown at any age, if you quit at any age of smoking, you do get some benefit. But of course, the earlier you quit, the better. There is also studies in female and women show that if you quit smoking in the 40s, you almost eliminate the risk of cancer in the 50s and the 60s. But the sooner you stop smoking, the better in terms of health benefits.
So how does the screening program work? Is it just one screening, or is it followed up by some other successive screenings for comparison purposes?
That's excellent question. So basically, this is a process. This is not a one test you do. It's a low dose CAT scan. A low dose means that the amount of radiation is 80% less what you get if you get normal CAT scan. So if your doctor said you need a CT of your lungs for whatever reason, this technique reduced the amount of radiation by 80%. And the reason why is radiation is harmful. So it's a process. The studies has been done up to 3 years. You do a CAT scan once a year after 3 years. And then that will determine if you have a problem or not. If the first CAT scan did show a problem, then you need to follow the path of prognosis and follow-up CAT scan. So, for example, if you show a nodule in your lungs, the question becomes, is this a cancer or a benign? Then there is a different pathway you go through. So if the first CAT scan was negative, then you get another one in a year, and then another one in a year. And then further on, you have to discuss with your physician if you need any more or not. The study has been done up to 3 years. If the first CAT scan did show an abnormality, then you and your physician will determine the path to determine if this something needs attention or this is something benign does not need attention. And that's why it's very important that those tests be done in places or centers who have an experience in dealing with those cases. And usually that requires a multidisciplinary team. And what do we mean by that? We mean that we have multiple physicians or multiple specialties: radiologist, pulmonologist, cancer specialist, thoracic surgeons. For example, at the cancer center we have in Hannibal, we have a monthly meeting with a multidisciplinary team where we have the pulmonologist, thoracic surgeon, pathologist, and radiologist. And then the CAT scan gets reviewed and a decision is made. The reason is 20% or more of the findings you find are benign. So not every nodule, not every finding on the CAT scan means cancer. Actually, the chance that this is a benign finding, which means not cancer, is much higher than the chance this is a cancer. And that's why you need to have a skilled team to determine if this is a cancer or not, and to determine the appropriate follow-up process to make sure that the patient is not exposed to extra testing or extra procedures that are unnecessary.
Okay. Once you go through all that, how's the patient notified of the results?
Well, usually the patient will go through the screen, and then the results of the CT scan will be sent to the ordering physician, which is either the primary physician or the pulmonary physician. And what we're planning to do at the cancer center is that those CAT scans all get discussed with the multidisciplinary team, where those group of physicians I spoke about will be present in the same room. The CAT scan will be showed, and an opinion will be made if this is something benign or something need to follow up. And then if something need to follow up, you need to determine for how long and how frequent. For example, you may say, okay, well, this looks suspicious. We need to get a CAT scan in 3 months or 6 months. Or this doesn't look too bad, maybe just in a year follow-up scan. And then the second question is that, what is the next step? Should we take a biopsy out of this thing or just watch it? And that's why it's very important to have specialized center that'll deal with those cases, because you don't want the patient to be exposed to unnecessary procedures. And I think for the success of this program, since it's just starting across the country, there should be a national database that all the specialized center report into, and a comparison between different areas in the country to see how many abnormal findings we have and how the follow-up process we have and what's the outcome. Because the initial study showed 20% reduction in mortality, which means we are saving 1 in 5 lives. So that's fantastic. We have 20% reduction in the risk of lung cancer being the number 1 cause of death. That's a huge success. The question becomes, is this reproducible? And the only way to reproduce this data is to have specialized center that do the screening process and report into a national center where this data is being processed and compared across the country.
Are you saying, doctor, that there is no such database center right now?
Well, this is just new. The studies has been done in the last year and a half, and the data is still coming. This is a new process across the country. there is a study came out almost last month only showed that this is a cost-effective technique because when you compare the amount of money spent on this procedure per the quality of life saved, this showed to be a cost-effective technique. Now, those studies are done at the research centers. The question becomes, is this translated into the whole nation? And this is still something that we don't know about. So it's very important that the screening done at specialized center that has providers experience in this thing, and then over the next 5 or 10 years, this gets reported into a national data, and we keep analyzing the data and learning from this process.
It's just a matter of time.
It's just a matter of time and experience.
Interesting. All right. Very good information here, and this will be interesting as we move through the next 10 years.
Absolutely, but something we need to make it clear to the audience is that this is not a replacement for smoke cessation.
Correct.
Smoking is still number one cause of death and number one cause of lung cancer, and there's no program can replace smoke cessation, and no prevention is better than smoke cessation, as we said. So I want people to think that I got a CAT scan on my lungs, my doctor said my CAT scan is fine, this means I can continue smoking.
No.
That by no means replace that. So make sure very clear to our audience.
So don't start smoking, and if you do smoke, quit.
You're going to get benefit at any time, even if you quit at the age of 90, you will get some benefit.
There you go. All right. Great information. Dr. Farah, thank you very much.
Thank you for having me.
That's Dr. Humam Farah with the Hannibal Clinic, our guest on Healthy Dose. If you'd like more information, you can just go online, hrhonline.org. It's brought to you by Hannibal Regional Hospital and Hannibal Regional Medical Group.